Hi everybody, it's Danielle Belec and I've just had my second hip replacement 3 days ago. Hard to believe, but true, look. And I'm just going to go through some of my rehab body movements that I feel like doing and share them with you. I've had an anterior hip replacement on my left side. 3 years ago I had a lateral hip replacement on my right. I was a former dancer and extreme athlete, so I guess it caught up with me one way or another. So I would like to record my progression over the next few weeks or months for those who might be able to benefit from it. And so here we go. Let's see. This is November 13th. My surgery was at 10 o'clock on November 11th. So we are a couple of days into a new bionic hip. And I'm doing extremely well. So as you can see, I'm moving quite well. So I'm just going to start as I always do, lying on the floor and start to get inside my body, and I'll talk while I explore. Always beginning with the breath. Just to sort of figure out where the heck I am. So I'm doing this to release my upper back, which has been quite tense because I've been lifting out of my pelvis and feet because of the pain. I'm already walking without a cane or walker, but it's still painful sometimes. And from dancing for years with my arms over my head, my upper back is quite flat, so sometimes it gets quite tense, and my shoulders have been holding with the cane and walker a little bit. And I've been in bed a lot, so I'm just going to open my upper back here a little bit to start. And I'm going to start with puppet arms, where on the exhale I float my fingertips up towards the ceiling as if strings were pulling them gently, and I was made of wood and the puppeteer was gently drawing my fingers up and at the top of this rounded curve of my upper spine, into which I'm breathing to open up the facet joints and ribs. And then I just lay my shoulder blades and arm bones back into the sockets, feeling wide in the collarbone and wide in the shoulder blades. Again, inhale to open, palms facing each other. You can always rub them together to get some sort of energetic feel. Eyes in folds and elbows, which I call the butterfly of the elbow, folded and facing each other. So not like this, but like this. And not locked elbows, but also not bent. Fussy, aren't I? Inhale. And out. Moving on the exhale. Movement rides on the exhale. Inhale into the open cup shape of my upper back. And exhale the shoulder blades down. The next thing I feel like doing, so I'm going to do it, is just interlacing my fingers behind my head, wrapping my elbow bones up a little bit to create a kind of cradle around my skull. And of course, the upper arm bone is connected to my hand and my head, but the lower part of my arm bone is connected into the shoulder blade in this mid area around the bra line. So that's the whole upper and middle rib cage. So in fact, I'm cradling my rib cage. So I inhale to breathe, exhale to release into the back spine between the shoulder blades through the sternal bone, reaching the elbows ever so gently towards the ceiling this way, and creating a cupping in the front of the body that's concave and convex in the back. And I'm doing this to open my back space of my body. And I land the weight of my upper body right here. Just dropping it in to this space. I breathe laterally as if I had gills on the side of my ribs. Expanding width. Exhale, hollow the front body into the back body. And this is called head cradle, which is the beginning of learning how to take your head off the floor properly from the abdominal muscles and not your neck, as taught in my work. So taking a breath in, I'm moving to the lower body. Now that I've opened the upper body, I want to open the spine and pelvis of the lower body. You can see how amazing this hip already is. In 2.5 days, I can flex my thigh. I can bring my feet quite close to my pelvis. I am blown away. So taking a breath in landing into the back curved space of my upper spine and ribs, leaving my shoulders quiet and standing down, vertically backwards and down into my feet, shin bones, knees into feet, allowing the pelvis to float up. This is called forward pelvic shift. The pelvic is shifting forward in space. That is the front of my body facing the ceiling, taking a breath in. Exhale, and just allowing the fold of the hip joint, sitting bones opening and smiling. So it's not from your lower back and neck. It's from your hip joint, and it comes from pressing down into the earth. This is day 2.5, ladies and gentlemen. It is mind-blowing. New hip. And lay down the spine so it's a little bit longer. I've opened the top of the spine. I've opened the bottom of the spine, and my spine in the middle is longer from head to tail. I have a right half of my body and a left and a midline from which I can now work. These are the 5 jewels. First jewel is forward pelvic shift, thigh lift, head cradle, knee drop, and arm reaches. We've done 2 of them. Head cradle, forward pelvic shift in a different order than's in my training manual. And I'm going to move the feet away just now to give a little space for my pelvis to land without any pressure. And I'm going to start to play with pelvic femoral rhythm, which is simply means the dancer relationship of movement between the pelvic bone, the acetabulum or hips joint socket, and the thigh bone into the socket. How do they work together to move properly? Again, we're moving from our hip joints, not our lumbar spine, taking a breath in. Taking a breath out through the mouth, in through the nostrils, out through the mouth. At some point, there's going to be a sense of this exhale phrasing flow so that the upper body settles, the mid body, the lower body. I tell the knee as if there's a string on it to float up towards the ceiling, not towards me. And suddenly all the weight is on my right foot and back of my pelvis, and I gently drop it. Inhale to open your body with your breath, creating space to move. Exhale, release your eyeballs, your jaw, your chest, your ribs, your pelvic bone and sacrum center. As the knee goes up, the foot goes down because it's a transfer of weight. This is my new old hip from 3 years ago. Lateral procedure and down, and inhale deeply. And exhale. Knee up, foot down, wide back pelvis, wide back rib cage, bra line heavy, sacrum heavy. Oh, why not? Let's bring them up. Inhale deeply. Elbows float up without your pecs pulling them. Exhale. The back wall of the arm bone into the shoulder, into the elbow. And here we are in what I call caterpillar curl. The 2 ends of your body are curled up. And I'm going to exhale, draw my pelvic floor in and up, send the legs out. Inhale, bring the knees towards me. Exhale, soften the sternal bone, concavity front, convexity back, land the upper body into the area of the solar plexus, then add the legs, pulling the pelvic floor up like a little zipper or a string. Listen to the language. Exhale, following the inhale, hollow out. Gentle reach of the elbows towards the sky, using your serratus to pull your shoulder blades around you, interdigitating with the external obliques, landing, creating a long tail. Exhale, land, pull the pelvic floor up, send the tops of the feet away from you. Inhale, and softly melt the bones back into the floor. Head is last. 1 and 2. Inhale deeply. Exhale. Press the feet and palms down. Inhale deeply. Exhale. I'm only going to lift my new hip up. I'm not going to stand on it today because it's a little scary. So I'm only going to do one side of that. I'm going to take a breath in deeply, and I'm going to exhale. And we're going to go into leg slides. So just sliding the heel away from the sitting bone, and look how long I can open my hip joint. Is this extraordinary? They pulled the TFL and quadricep tendon apart and built the ship inside the bottle inside of me, and then put the muscles back together without cutting them. My knee to ceiling, my heel towards my sitting bone. Take a breath in, open up, soften, third eye, jaw, sternum, pelvis, opening the back ribs. Slide the heel away from sitting bone. That's all you think. Heel, sitting bone, heel, sitting bone. Flex the foot a little bit if you want. Let it drop and open. Take a big breath into the groin area. Exhale and be here. Settle and let the whole pelvic bone lengthen out, down towards the foot. Inhale, turn the knee to the sky. Exhale, release third eye, sternum bone, pelvis. Knee up, heel slides to sitting bone. Knee up, heel, and land on your foot. Land into the joint and stand. Standing on your own 2 feet is my alternate term for forward pelvic shift. Inhale deeply, exhale. Caterpillar curl, simultaneous, and all the weight just lands down. Let's do some little circles here for fun. Maybe a little bit of, oh yeah, I still have obliques after my surgery. Yummy, yummy in my tummy. And down we come. One long slide out into just releasing. I just need a break here. And you'll notice my left leg turns out now. It hasn't turned out at all until now. It's so great. Of course, my right leg turns out a whole bunch because I used to be a dancer, and of course you always set yourself into first position and you always go right foot crank, left foot. So it falls a little bit more dramatically than the left side. We'll see what the left does in the next couple of months. Take a breath in and belly breath. Open like embers of a fire, radiating heat, and then gathering back in. Inhale, open. Exhale, release. Rolling the knee and the other knee, speeding this up a little bit. Knee towards sits, heel towards sitting bone, knee towards sky. I cannot believe how well my left leg is going today, and I'm going to try to just do little knee rocks. So I'm telling my knees to go to the left and my knees to go to the right. There are no counterindications except for pain after the anterior hip replacement. With the lateral one, you couldn't turn your spine, you couldn't bend your knee beyond 90, you couldn't bring your legs together for 6 weeks, and I think there were a few other things I don't remember. And I'm just going to let this go a little further and see if I can open up my waist into arm circles. Inhale, eyes follow the hand into taking the body and curling it up and over and up. Whoa, I can do that. It's wild. It's so soon. I can still dance. 3 days after surgery, Rodriguez, my doctor, Sebastien Rodriguez at the Humber River College Hospital, is clearly amazing. Fingertips reaching and creating an arc like a rainbow. This is arm reaches. I'm not going to go into the detail of all of that today. I'm just going to remind my body about my wings. And to knee drop, into curling, into sitting, and into thank you. So stay tuned for the next video. This is day 3, 2019, November 13th is a lucky number. Thanks for watching. Bye for now. You can watch me get up if you want. To be very careful with this part, but it's not impossible. Again, 3 days later, here I am. Ta-ta!